Okay, so in this particular video we'll be looking at two other paraphilias, namely exhibitionistic and frotteuristic disorder. According to DSM-5, the disorder is diagnosed in a person with recurrent, intense urges, fantasies or behaviors that involve exposing his genitals to strangers in inappropriate circumstances and without their consent. These individuals are called flashers and feel the need to shock, surprise or impress their victims. And this element of shock is highly arousing to these individuals. A disorder is diagnosed when accompanied by clinically significant distress or impairment. Exhibitionism also refers to a strong desire to be observed by other people during sexual activity. That is, in some instances, the exposure of genitals is accompanied by suggestive gestures or masturbation. A significant minority of exhibitionists commit aggressive acts, sometimes including coercive sex crimes. Despite the rarity of these aggressive and assaultive behavior, the intrusive quality of the act, together with the explicit violation of the proprietary norms about private parts, ensures condemnation. Okay, so these are some of the facts about exhibitionistic disorder. The exposure takes place in secluded locations such as parks, or it can occur in public places like department stores or churches, theatre, and other malls and other places. In many instances, the exposure is repeated under fairly constant conditions. That is, the person may come and stand near a school or college or in the same neighborhood or at the same time of the day. For a male offender, the typical victim is a young or a middle-aged female who is not known to the offender. However, children and adolescents may also be targets for these exhibitionists. Moving on, we look into the onset and prevalence. It generally begins in adolescence or young adulthood, and it is one of the most common sexual offense in US, Canada and Europe. According to some estimate, it is seen that as many as 20% of women have been targets of exhibitionists or voyeurs, and this particular disorder commonly co-occurs with voyeurism, sadomasochistic interest and cross-dressing. Okay, so this particular slide highlights the risk factors that are thought to cause the development of the disorder, namely antisocial history or antisocial personality disorder, alcohol misuse, pedophilic sexual preferences, childhood sexual or emotional abuse, preoccupation with sex and hypersexuality. All of these risk factors are thought to increase the risk of exhibitionistic tendencies, but the cause and effect relationship between this are yet to be proven. Treatment, medication to reduce sexual desires and sexual drive is generally very helpful. Behavior therapy, in which the person is helped to control the urges and use more acceptable means of coping, is also taught. Cognitive behavioral therapy, which typically involves cognitive restructuring, that is identifying and changing the thoughts that drive the behavior, combined with relaxation training, wherein the person is trained to reduce exposure impulses and teaching them coping skills, that is different ways to behave when feeling aroused, seem to be very helpful with exhibitionism. So with this we finish exhibitionism. We move on to another disorder called as the frotteuristic disorder. Not much has been discussed about this particular disorder in your reference text, so I keep it to the basic facts about frotteuristic disorder. Frotteurism is a sexual excitement at rubbing one's genital or touching a body of a non-consenting person. And you should note that this reflects an inappropriate and persistent interest in something that many people enjoy in a consensual context, but the fact here that this is a disorder is that they do it with a non-consenting person. This is diagnosed if Frotteuristic acts occur whether or not the Frotter himself is bothered by his urges. Frotteurism co-occurs with voyeurism and exhibitionism, and because typically it involves somebody who the person doesn't know, these people are at greater risk for sexual offending, but currently again there is no evidence to support this claim. Thank you.